You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and we're always excited to talk to Dr. Josiah Fitzsimmons from Vero Neuropathy, because we know that when he's done talking, people are going to be able to have a better life. They're going to be able to live pain-free. And he is joining us once again here this morning. Dr. J, we are talking about how it's almost magical how people come in to Vero Neuropathy. They come in with pain, and in a very short period of time, that pain is gone.
I mean, Lou, we just had a guy came in who hadn't felt his feet in over 30 years. 6 weeks in to our protocol, felt his feet for the first time in 30 years.
That is absolutely amazing. And we're talking about how Vero can treat neuropathy, even though some people are saying, oh, you can't do this. You are proof you can. Now, let's explain what neuropathy is first and foremost.
Absolutely, Lou. So neuropathy is a condition of nerve damage. And so you have this nice outer coating around your nerve that insulates your nerve from the rest of your body, because your nerves are what are signaling all those messages from your brain through your spinal cord out to all the nerves, to all your messages in your body, tell your heart to beat, your lungs to breathe. Everything is controlled and coordinated through your nervous system, and they're all electrical signals that are firing. And so they have this nice insulated coating, kind of like your cell phone charger has this nice rubber coating around that electrical wire. And so what happens with neuropathy is that coating deteriorates over time. That protective coating deteriorates with high levels of inflammation, prolonged levels of trauma, different medications. We'll get into the cause of neuropathy, but then you get electric shock-like sensations, burning, numbness.
Okay, so these are some of the symptoms that people are talking about here, right? Okay,
exactly.
So if you're experiencing any of these, continue,
yeah,
please.
So exactly. So if you're experiencing burning, electric-like pain, muscle weakness, numbness, prickling, tingling, sensitivity to touch, those are all signs that you potentially have neuropathy. And so we want to do a full diagnosis to figure out exactly what's going on, what's caused that deterioration around the outer coating of your nerve, because now those electrical signals are getting interfered with.
Okay.
And your body can't communicate, it can't heal, and then that's when it becomes very debilitating.
Okay, now you talk about peripheral neuropathy, and that is the extremities, like your hands, for example. You look at the nerves in your hands, for example, there it is, and that's what we're talking about here, right?
Exactly, so all the nerves start in your central nervous system, your brain, your spinal cord, and then they branch out to your peripheral nervous system, which is your hands, your feet, your legs, your arms, your extremities, and that's typically where neuropathy occurs first and foremost. Think about it, Lou, just like when you're cold in the winter, what gets cold first? Your hands and your feet, right? Okay. They have the least amount of blood flow. They're really the least vital part of your body. And your body says, hey, if we have issues, we need to protect our organs. We need to protect the vital parts of our body. And so your hands and feet can obviously kind of become collateral damage.
Okay.
You know, unfortunately, when you have that deterioration or high levels of inflammation for long periods of time, you get decreased blood flow into those areas, therefore decreased oxygen supply. Therefore, that coating around the nerve starts to deteriorate over time. Then you get the numbness, the tingling, the aching, the burning sensation. And that's where a lot of people start to have balance issues. And that's one of the biggest causes, of major injuries and death in older individuals is from falls. And so that's where neuropathy can become very dangerous. And you want to get on top of it much sooner rather than later, because neuropathy is a progressive degenerative condition. It's just going to get worse and worse and worse, harder and harder to do anything about.
Okay, we talked about what this is all about, but what are the major causes of neuropathy?
Absolutely. The biggest one that most people we see with is diabetic neuropathy. About 60 to 70% of people with diabetes will end up with neuropathy. That's a staggering number. About 2/3 of all people with diabetes will end up with a neuropathy diagnosis. But that doesn't have to be the case. We want to get on top of it. Also, we see lots of people that have had chemotherapy, that have radiation-induced neuropathy. Also, a lot of people that are on statin drugs, high cholesterol medications that are causing neuropathy as well. Lots of also traumas, lots of different farmers that are exposed to pesticides, just different toxins that slowly over time can cause inflammation in your body, and that deteriorates that coating around the nerve.
So there are a lot of things that can cause neuropathy that you're talking about here, but the good news is neuropathy can be treated. And the better news is that Dr. J and the folks at Vero have a special going on right now, and for $37, you can find out what they can do for you. Tell us about that.
Absolutely, yeah. So most places, like I said, just take a sharp stick or toothpick and they poke the bottom of your foot. Can you feel this? Can you not feel that? We actually do 8 different individual tests to calculate the exact percentage of nerve damage in the hands, in the feet, so we can come up with a comprehensive individual game plan for everyone that comes in. We're in network with Medicare, Blue Cross Blue Shield, United Healthcare, most major insurance companies. So give us a call. We'll do a free insurance verification on that very first visit. Normally over $200 to get all those tests done. Meet with the doctor one-on-one over an hour in our clinic. Only $37, Lou. It's such a no-brainer. If you have neuropathy, as I said earlier, it's a progressive degenerative condition. Typically, when you get over 80% nerve damage, it can't be reversed.
Right.
And so that's why it's so imperative to get on top of neuropathy sooner rather than later. A lot of times people say, oh, I can't feel my feet anymore. It's getting better. Well, no, that's when you're getting maybe even a further progressed
I'm glad
state.
you said that because we ran into somebody who had that same condition. Well, I thought I had neuropathy for a while, but now my feet are feeling better. Well, that's not necessarily a good sign. That could be a worse sign.
They could even have less feeling, so then they don't have the numbness, the tingling, the shock, burning sensation anymore, so they think, oh, that's good, I don't feel those, but then they don't realize that it's actually getting worse. I mean, we've had, unfortunately, numerous people that have come in that have stepped on nails to the bottom of a foot. They don't even know they take their shoes off at the end of the day, and so it can become very debilitating. Amputations, walkers, wheelchairs. We want to avoid all of that, get to the root cause, get your body to heal the way God designed it to.
515-335-VERO. That's the number to call, 515-335-VERO. And let Vero Neuropathy get rid of your neuropathy pain. Thank you, Dr. J.
Thanks, Lou. Thanks for having me.
When we come back, we're going to visit with the Des Moines Whiskey Festival and meet a distiller from Shelby County. You'll love this. That's next.